Welcome to Easy Endo Prep's Endo in a Bite. I'm Dr. Sumbul Beg, and this podcast is your ideal study snack, built for busy endocrinologists who want fast, board-relevant content that actually sticks. Whether you're certifying, recertifying, doing DLKA, or just staying sharp, I've got you covered. Today's bite: vaccines in patients with diabetes. I spotted this in a recent board review resource, and that means it's showing up, so let's break it down. First, hepatitis B. We know that individuals with diabetes have a heightened risk of acquiring hepatitis B, particularly due to possible percutaneous exposures like glucose monitoring devices. But it's not just about infection rates. When they do get infected, they have more severe outcomes, including increased rates of hospitalization and mortality. The CDC currently recommends hepatitis B vaccination for all adults with diabetes aged less than 60 years. For adults age 60 and above, the guidance is more nuanced. It comes down to clinical judgment. You have to assess the patient's individual risk factors and likelihood of benefit from vaccination. As for hepatitis A, despite some similarities in transmission, the CDC does not recommend routine hepatitis A vaccination for individuals with diabetes, even for those who travel frequently. Influenza is more straightforward. This one's universal. All patients with diabetes should receive an annual influenza vaccine, no age restriction, no special caveats, just do it annually. Now let's transition to pneumococcal vaccination, which gets a little more complex, but also more high yield for exams and for real-world practice. Diabetes increases the risk of invasive pneumococcal disease significantly, and that includes pneumonia, bacteremia, and meningitis. On top of that, we're looking at up to a 50% increase in mortality from pneumococcal infections compared to the general population. So vaccination here is essential. There are two main types of pneumococcal vaccines: pneumococcal conjugate vaccines and pneumococcal polysaccharide vaccine. In the pneumococcal conjugate vaccines, we have PCV13, PCV15, and PCV20. In the pneumococcal polysaccharide vaccine, we have PPSV23. Now here's how to use them. If you're using PCV20, that's it. PCV20 is one and done. And if you go with PCV15, then you must follow it up with PPSV23 with 1 year in between. How I remembered it was that when a kid gets a learning permit, even if they're 15, they need a 23-year-old to supervise. They can't drive alone. So 15 goes with 23. However, a 20-year-old can drive alone. So PCV20 is one and done. PCV15 needs PPSV23 with a 1 year interval. Here's a key nuance to remember. If your patient already received PPSV23 but never got a conjugate vaccine like PCV13, you don't need to start over. Just layer in the missing conjugate dose. You can give PCV20 now, and that's it, one and done. Or if you're using PCV15, just make sure there's a 1 year gap between the old PPSV23 and the new PCV15. There are a few other key vaccines we should be ensuring in our patients with diabetes. Starting with influenza again, this is an annual vaccine strongly recommended. That includes not just diabetic patients, but also those with cardiovascular or pulmonary comorbidities, immunosuppressed states, or those in contact with high-risk individuals, including healthcare workers. Then we have COVID-19. All adults, including those with diabetes, should receive primary vaccination and boosters per the latest CDC recommendations. This one's in constant flux, so stay updated on the most recent guidance. Respiratory syncytial virus, RSV, is a newer one in the mix for adults. For patients age 60 or older, one dose can be offered based on shared clinical decision-making. And finally, don't forget herpes zoster. The recombinant zoster vaccine, which is non-live, is recommended starting at age 50, given as a 2-dose series. That wraps up vaccines in the diabetic population. If you've missed anything, don't worry. I've taken all the notes for you. You can get a summary delivered straight to your inbox, headings and bullets. Just head over to www.easyendoprep.com and subscribe to the newsletter. Thanks for tuning in to Easy Endo Prep's Endo in a Bite. I take the most relevant points for the endocrine boards and chunk them down into bite-sized pieces of knowledge. Until next time, stay curious, stay consistent, and keep it bite-sized.